Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The sexual side effects of chemotherapy. Whenever the topic of chemotherapy side effects arises, we tend to think of hair loss, weight loss, and how sick the drugs could make us feel. What we don't often think about is sex. /r/n/r/n Maybe that's because cancer and sex are two words that seem to cancel each other out when placed together. And, more often than not, sex is the last thing that comes to mind when faced with a cancer diagnosis. /r/n/r/n But the simple fact is this: intimacy is important when going through cancer treatment. Sex and close intimate contact are known to promote feelings of well-being while moving you closer to your partner when treatment gets tough. This is why it's important to understand both the direct and indirect impact chemotherapy can have on your sex life, whether you are 17 or 70. /r/n/r/n People will often ask their healthcare provider when is the right time to have or resume sex with their partner. For most undergoing chemotherapy, sex is not only medically permissible but it's also encouraged. /r/n/r/n In other cases, the opposite is true. People undergoing chemo are at often risk of developing neutropenia, a side effect of treatment that results in a low white blood cell count. These cells are vital for fighting off infection, and, without them, we are at risk for illnesses that might otherwise be harmless. /r/n/r/n And that's where sex can become a problem. Whether vaginal, anal, or oral, each of these activities has the potential to pass infection. While condoms can usually provide protection, it's important to speak with your healthcare provider to make an informed choice based on your current health and any risk factors you may have. /r/n/r/n If your immune system is severely compromised, sexual abstinence may be the only sure way to avoid infection. /r/n/r/n It is important to always use birth control while undergoing chemotherapy, which may be mutagenic and induce birth defects. Both men and women should protect against pregnancy during chemotherapy. /r/n/r/n Chemotherapy can affect your sex life by either diminishing a person's sexual function or giving rise to infections that can interfere with sex. /r/n/r/n Some of the most common complaints. /r/n/r/n The good news is that most sexual side effects of chemo will go away after the completion of therapy. Symptoms can vary from person to person, with some being especially hard hit while others have minimal impact. /r/n/r/n The main thing to remember is that the absence of sex does not mean the absence of intimacy. Even if you are unable to achieve an erection or endure intercourse, intimate touching and caressing can bolster both your outlook and feelings of self-esteem. /r/n/r/n If experiencing any problems with sexual function, either emotional or physical, don't be shy about expressing them to your partner and healthcare provider. Communication is always key to remaining connected to both yourself and those who can help you. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.